Hello, I'm Dr. Eric Topol, Director of the Scripps Translational Science Institute and Editor-in-Chief of Medscape Genomic Medicine and theheart.org. In this series, The Creative Destruction of Medicine, named for the book I wrote, I'm trying to zoom in on critical aspects of how the digital world is creating better healthcare. So one of the big questions we have now is whether doctors will be replaced by algorithms. This was really precipitated by Vinod Khosla at the Rock Health program on health innovation, when he said that 80% of doctors are going to be replaced by algorithms. And that comes right in the face of all these projections about physician shortages of hundreds of thousands of doctor shortages over the next 10 years because of the baby booming problem and the aging of the population, as well as the chronic disease burden. So which is right? Are doctors going to be replaced by algorithms? We do know that there are such remarkable changes in the digital infrastructure, giving capabilities. So for example, things like skin apps to be able to preempt the need to have biopsies just by having a picture of a skin lesion through one's phone. Then there's being able to refract one's eyes through an add-on to the phone like iNetra, and then which costs a couple of dollars and gets your eyeglasses made through a text. And why do we have to go to optometrists, for example? Another example is this device that you can take a picture of a child's eardrum and have an algorithm detect whether or not there's an infection because it's magnified tenfold. And why would you then have to go to a pediatrician visit or to an emergency room? So these are just some examples of how algorithms can be used to take the place of many of the things that have traditionally been in the healthcare professional or doctor's domain. And of course, it's just the beginning of this movement, and it's threatening to physicians. But actually what I think is that there's this very interesting issue that it's somewhere in the middle. That is, we don't have an imminent physician shortage because the efficiency of physicians is going to be markedly increased in the digital era, just with some of those examples I've given, and a whole lot more going forward. But the model for physicians is going to be remarkably different. And that is because so much of this can be processed automatically, artificial intelligence, the need for the processing will be reduced on the physician side, but on the other hand, the humanistic, compassion, communicative, judgment, experience, all that stuff is going to be emphasized all the more. So I think both of these are right. There are two different trends going in the opposite direction. It'll be really interesting to see how it plays out over time. Thank you for joining us for this segment, and stay tuned for more of these about the creative destruction of medicine.